So my name again is Chris Bailey. I started in Corey with physical therapy practice there that I bought from my dad about 4 years ago. And at that time it was just me and my dad and then a couple other ladies who were helping us in the office and in the gym down there. But what I saw was this company FYZICAL kept sending me information in our clinic, and their big thing is balance and fall prevention. That's the thing that really sets them apart. And I started to look into it, and what they did is they brought on a guy who created this whole balance system out in Las Vegas. He'd see between 80 to 100-ish balance patients at his clinic every day and developed this whole system that we'll get into a little bit that was just really ingenious. So I saw what they were doing and realized how much different it was than anything that I'd come across before. So I joined the franchise in 2016 in our office in Corey, and we put on a little balance center. Yes?
I can't hear you.
Okay, that's good to know.
So come on up.
So this, maybe I'll talk over here. So FYZICAL is a franchise that I got into in 2016, and it started in Florida. And we have an office in Corey, and we built on a little balance center down there. It was like 600 square feet. And then after that point, we started to see more and more people come from Waterford and Harbor Creek and Erie because some of the services were pretty unique that we had. So we wanted to get up to Erie because we knew that there was a need up here. So that's when I got in contact with Kurt, and we kind of came together on this idea of this balance center up here. So that's how that kind of started with that. Kurt was previously at Impact Physical Therapy down the road, and now he's here full-time with all of us and everything that's going on here. So one of the main reasons why FYZICAL really looked into this balance program is because they recognized nobody was really doing it on a big scale, and nobody had really good answers or ways to treat people. So these statistics are from the CDC, Centers for Disease Control, but every second older adult falls. And with the baby boomer generation getting older, this is just going to be more and more of an issue. The other thing is 1 in every 4 adults, older adults, and that was over 65 in 2014, had a fall at one point or another. And the other one is falls are the #1 cause of hip fractures. And if anybody's had a hip fracture or knows people that have, they're generally in the hospital for a long time. It can lead to all of their complications. So they developed this system to try and combat some of these things. And if a person did fall, to try and get them to recover so they wouldn't fall again. So there's three different parts of our balance system mainly. We have our feet that give us sensation, so we can tell what kind of surface we're on, if it's something soft, if it's something firm, and also if our ankles sway and our brain can correct if we start to move different ways. We have our vision system, so if I stand here, it tells me how far I am, the depth perception from something. So when I close my eyes, I don't know how far something is, so it's harder to keep the balance without the vision. And then the other one is the inner ear system, or the vestibular system. Has anybody here had vertigo at all in the past? So quite a few. They say the statistics kind of vary, but between like 30 to 40% of adults at one point in their life have vertigo, which means when you lay down or when you stand or move, it feels like you get a horrible sensation that the room's just spinning or that you're falling backwards. So the inner ear system does a little bit of that. So this is the model of the ear. This is the inner ear here. It's called the vestibular system. And what that does is it's a group of sensors and deep into our head back this way. And what they do is they tell us if we're going like this, or if we're turning like that. And you have these 3 canals right here on each side. So each side of your ear has these 3 canals. What can happen is you can have crystals that come loose. Have people heard of that before if they've had vertigo? So there are crystals down in this bottom part and through here that are attached, and most of the time we don't even know why they come off, but if people fall and hit their head, that can be a reason why. There are some other diseases that can make it so that they lose more crystals, but they can go up into these canals, and these canals have a little stopper at the end. When the crystals get in those canals, what happens is that our body thinks that we're doing this constantly when those crystals are out of place, so it just feels like we have vertigo. So that can really cause some problems. It can cause nausea, vomiting. That can last a few days, a few weeks. We've had a few people here who they've had it for years, and yeah. So the corrections can be fairly simple sometimes. So there's one other demonstration I want to try for this, but we have these goggles here, which are something else that physical kind of brought to light more in the physical therapy world, is that they're infrared goggles, and what they do is they look at how the eyes move in the dark. And you think, well, what does that have to do with the inner ear? Well, these guys and some other people before them figured out that if the eyes move a certain way, for instance, if we lay somebody down and their eyes move upward, we know that that debris is in this canal. So you can tell by the eye movement in these goggles what canal the debris is in. So if we know if it's in, they call this the anterior, the front canal, you have a horizontal canal, and that's the posterior canal. What it does is we can identify based on the eye movements exactly where that is, not only which canal, but which part of which canal it's in. And then we can do movements to get the debris out of there and get it back where it belongs. And then that vertigo can subside sometimes in just one treatment. So it's a really neat procedure, and they've come such a long ways. I was a therapist for 10 years before I even heard that this stuff existed. We didn't learn it in school, so there's a lot of new things that have come to the horizon to help people with vertigo and balance issues. So it's a really interesting system. So if people have an inner ear problem, the crystals that we kind of talked about, they can come loose. They might feel just off balance or have difficulty with their walking. They might have sensitivity with their vision, especially like when moving your head, and it can create a feeling of more vertigo or more dizziness. The big one that a lot of people don't know, but we see often, is the people who have this problem have trouble with concentration, because part of the vestibular system helps to control flow of information into our brain. So people who've had concussions and they have a concussion to this system have trouble with remembering or have trouble with concentration. When their inner ear system gets stronger, they get better with the concentration and with the ability to focus. A lot of times the other thing that they talk about is a feeling of fogginess in the head. They just feel like they're not clear with just everything in general, and a lot of people just say, I just feel foggy. So what are some of the risk factors that can contribute to falling? If somebody has lower body weakness, and we look at that in a number of ways, if they just have difficulty with their walking and balance, if they have vision problems, if they have foot pain or poor footwear, sometimes they can catch their toes more easily, if they have too much medication, or maybe they're on a medication that can cause dizziness. And one interesting thing is have anybody here, have they taken meclizine? It's one that kind of calms down the inner ear system.
They gave it to me, but I never got it. I got it filled, but on the label it said may cause dizziness.
Right. Okay.
Yeah, so I never took it.
Yeah.
So this is something that we see a lot is meclizine is a drug to help reduce vertigo, but the new studies show that you should only be on it for 1 week, because what happens is it suppresses how the inner ear system works. So if it's overactive, it brings it down. But then if you take it for a long time, we don't want the inner ear system to be working down here. So it actually makes you more at risk for a fall, because you can't catch your balance as well if you're on it. So it's a weird thing. So really only if people have severe dizziness do the doctors recommend that they really take it for longer than like a week now.
Did it help you when you took it?
It did, but I didn't take it longer than a week.
Yeah. So it can help for short periods.
For short period.
Yeah. The other thing is home hazards. So broken steps, uneven steps. If there are rugs, that's a big one that we see if people trip on rugs. One that they don't talk about a lot, but we hear all the time, is animals at home. So people will be walking their dog, they might have a big lab or even a small dog, it'll get caught up in their feet and they end up falling down. There have been dozens of these between Corey and even a few up here already that we've seen because of animals. Not that people are going to get rid of their animals, but it's just a factor that I think is definitely relevant. So what can you do to prevent falls? So one thing is a lot of people might not even know they're at risk for a fall, or they might just think that it's a normal occurrence. We do a free balance assessment here. Other places can do them as well. That's one way. Another way is just to talk to your doctor if you have any of those symptoms like we mentioned here. There will be many of us around here to answer questions about it or to talk to your physician about it, especially if it might be medication related. And the preventative ones are programs like Silver Sneakers. Does anybody do that here? Yeah, a few? Good. Or there's Tai Chi, Sit and Be Fit. Those are really good programs where they keep working on a weekly basis on improving the strength and some of the balance systems. The other ones are to have your eyes checked. Now, one thing that we see is there are very few eye doctors who look at the test that we did with you to see if the inner ear is causing the vision problem.
I never had anybody do that.
Yeah, and so it's not real common, but sometimes that's the main reason why people have dizziness or vision issues is because they can't focus while their head moves. So it's not an eye issue necessarily, it's more how the inner ear interacts with the eyes.
Can you fix this?
You can, a lot of people. Yeah, sure.
Another thing that I find with vision that some people can't live without is bifocal lenses. Bifocal lenses with vision, if you stand upright and just look through the bottom of your bifocal, you really can't see the floor. It obstructs your vision. And so therefore you see people doing a lot of head tipping. If they have crystal problems, tipping your head is not really a good thing for a lot of people.
Right.
And the second factor is it causes neck strain and postural problems. But also if you're going up and down stairs, people sometimes catch their feet on things because of the bifocal lens. Now I'm not claiming to go out and get rid of your bifocals. I need bifocals. I have 19 pairs. But anyway, that is a fact. It's something to consider. It's almost like you should have a lens that you can turn upright and only use a bifocal when you need it. So.
I'm glad Kurt can talk to the bifocal thing. I don't know about that yet, but probably in a few years. Thank you. Some other ones are improve home safety. So this would be if there are the trip hazards, the rugs, that's a big one. Other things on the floor, just clutter. Handrails, that's a big thing. People don't have those sometimes in the bathtub or even going up a few stairs in their home where we see them have trouble. Going into the basement if you really need something to hold on to. And good lighting, so you could see with your example when you close your eyes just how much that affects your balance. So if you get up in the middle of the night and there are no night lights on, you don't get any of that reference with your vision. So therefore people are a lot more unsteady, and we see people fall at night because they don't have good lighting or good night lighting. So what's a little bit different with physical? So before, when I had a physical therapy business, we had the belts. Anybody ever have to use a gait belt at all or see what they are? It's like a little belt that people hold on to. So that's how we would hold on to the patients and go to do something. Well, the problem with those is that the patients can't build up much confidence because there's a therapist constantly holding on to them, for one. And the other is they're at a risk for fall, and the therapists are. If you have somebody my size and a 300 or 400 pound guy, if he's going down, we're both going to go down. And there have been many close calls and before when we use that system. So what physical uses are those overhead systems and harnesses. So they keep everybody upright. When we do the balance assessments, we use those so we can get a better idea of what's wrong. And then when we start to do the corrections, we use those systems, and they're phenomenal. I underestimated how much confidence people build in those systems because we don't have to hold on to them, so we can really utilize just that whole system like that. Sarah has one. It looks like a rock climbing harness. It looks slightly intimidating, but it's not. It's just like a book bag. So that just goes on. Thank you.
Yep.
You'll be our model there. Okay. So it just goes on like that. Yeah. The other thing is we utilize specialized equipment to retrain the balance, like on this shuttle balance machine. So for your training on this, part of it might be we have you start with a wider base of support, and then you would close your eyes, but just for brief periods. And what that does is it helps to retrain that system. And you'd be in the harness and you'd be in that rope system, so you'd know you wouldn't fall. And you're able to work it at a little bit higher level. But what you do then is we start to just make it a little bit more difficult, just like if you're working out with weights. You know, you'd start with 5 pounds doing curls, they'd get easier, you'd increase the weight or the number that you do. With this, we'd increase how difficult it is for people, and they just get better and get better and get better. And a lot of times, especially with this, you could see changes in 1 week's time for the positive and how your balance is doing. So it's a really unique system. We have these computerized plates. Physical's developed a really great system where we test the balance on an actual computer, and then based on the scores, people get put in a different track. So they might be this type of balance person or that type of balance person. We know exactly how to retrain that based on the system that they've created. And the other thing that I kind of already talked about are those goggles that we have people wear, and we use those as part of our evaluation, especially if we suspect vertigo with people. So commonly asked questions, is balance therapy covered by insurances? Medicare especially has made a big push to have this covered, and it is. For all major insurances, they have no issues with balance therapy. They would rather have somebody come for balance therapy if we see there's an issue, get it corrected before they have a fall and end up with some other major issue. So they're looking at it in a few different ways. So what type of balance problems do we treat? Basically, one thing, if people feel just unsteady on their feet in general, if they have difficulty with their walking, this could be in any way. And sometimes they have balance issues because they might have a foot issue, so we look at those things too, or a knee issue, to maybe correct those other more joint issues related to balance. Vertigo, like we talked about, and all that goes on with that. If there's just dizziness, and that can mean a little bit of everything. Some people feel dizzy, like lightheaded or woozy. I would say that's kind of like dizzy or vertigo, like your kind of symptoms that you explained, that you just feel like things are kind of moving and you're not real stable. And the other big one is leg weakness, and we'll do something with that here in a second. So how long is a typical balance treatment? So if somebody has vertigo and the crystals are loose, they could be better in 1 week's time. But the average person still has a little bit of lingering issues because the crystals, when they come back into place, there's balance problems that persist, but they can get better. So most of the time it's about 4 or 6 weeks with therapy, depending on the conditions, how long it generally will take. Now we're going to try a couple little exercises, if you're able to. The first one we're going to do is over here. We're going to try this sit to stand. So this is actually a little test. So you could put that information in front of you or beside you. And if you have trouble coming up from a chair and you know you're really unstable, don't worry about doing this. But what this is it's to see if you can come up out of a chair without the use of your arms. So you can put them out in front of you or up over your chest, and see if you can stand up from that position without holding on. Okay? All right. So now, okay, go ahead and sit back down. There's a test that we do. It's called a 30-second sit to stand test. And they've actually developed this based on your age to see how many times you should be able to do that. And until you get into your 90s, in 30 seconds, you should be able to do that about 9 to 10 times, basically. And what that shows is that if you can't do that, you have a lot of weakness in your hips and your butt muscles and in your legs. So there's certain ways we test for that to see what exercises can get that a little bit better. The other one is, so if people have trouble standing on 2 feet, don't worry about this one. But whoever can stand on 2 feet, go ahead and stand up. And then what I want them to try and do, and if you have something in front of you, it might be helpful. Oh, sorry, I didn't mean to throw your stuff there. Here, if you have something to hold on to, okay? Thank you. So if you try to stand on one leg at a time, see how long you can do that for. And just count in your head. So pretty much okay, good. See about the other leg. That's good. Good thing that's there. No? Okay. All right, good. So most people have an idea. So what this should be is everybody should be at 10 seconds is what they say, regardless of age on each foot, okay?
Pass that test.
Yeah, pass that one, good. Okay. That's good, you guys can sit down, thank you. One exercise we have people do a lot of times for home is simply that. Now if they can't stand on 1 foot without holding on to anything, they might hold on to a countertop. And they could start there and hold on with just the one leg, just until you build up that stability in that foot and the ankle and everything. And then they can go to no hands is what we want to try and have people do, depending on what problems they might have.
Recently, we've seen quite a few patients that have lumbar spine problems that's relating to a lot of their imbalance.
That's a good point.
Where, with the rash of back pain and lumbar stenosis and herniated disc, we've seen people recently, just kind of things going with clusters. It's been a cluster lately. It's been a lot of lumbar issues, which is treatable, and it kind of goes hand in hand with all the stuff that we see.
So the lower back issues can create weakness in the legs, and it can create so much pain that somebody could limp, which can lead to a fall. So to Kurt's point, it's usually a number of things. So this is two different things. What this shows is your fall risk, okay? So on this little thing here, it shows if you're up above 4, there's a pretty high likelihood that that person might have a fall in the next year is what this is based off of. So if you're above about a 3, they really recommend you get your balance assessed. Now, the part that this doesn't take into account is if people just have dizziness. And that doesn't really necessarily mean that you fall, but the dizziness can affect so many other parts of your life. You just feel like your vision is not right. You feel like you can't focus. When you're in crowds, you have difficulty with maintaining kind of your balance, and just it kind of gets overwhelming. So that's a totally different thing that we look at to check out too through some of those tests. But some of the other common questions that we have besides the leg weakness, besides does insurance cover it, is what types of things do you do? So basically we try to find what part of the system is weak, and we just try and make that stronger through this program. So it's some exercise for both the vision and the head usually. A lot of times it's neck stretches because the neck can get tight. If the eyes bother people, they tend to stay stiff like this, and a lot of them end up with upper neck issues.
That's me. I can't relax my
and it's-
shoulders. I found myself even driving, and I'm driving like this, and I'm thinking, why are my shoulders up here?
Yeah.
And it's like you
So they're
have to
just
learn
trying
to.
compensate for a week in or year system. It's on that sheet there. So if anybody wants more information, we're going to be having more of these seminars on about a monthly basis. There's going to be some on hip pain, on back pain, on our laser therapy that we do. Kurt's going to put on one about running. He's a running specialist, so more on the sports end of things. So we're really trying to cover all these different topics. CBD oil is a big one that people are talking about now. We've had a lot of success with certain patient types with that. So we're really trying to take more of a global approach to things. So if anybody has questions about anything on those sheets, please let me know. And please fill those out if you would like the mailers, even if it's just your information. You don't have any interest of anything at that time, because we're going to start with a patient newsletter that'll give a lot more info on everything.
Thank you.
Thank you, everybody, for coming.